A ceremony took place this afternoon to mark the conclusion of the two-week course held under the auspices of His Excellency Dr. Mohammed bin Saif Al Husni, Minister of Health and Secretary for Health Affairs. The two-week training, carried out along with workshops and field practices, took place to meet the ever-changing requirements of healthcare professionals' requirements that infection preventionists constantly update their knowledge base and expand their skill set. During the ceremony, it was highlighted that the control and prevention of healthcare-associated infections, especially antibiotic-resistant bacteria, requires activating infection prevention control programs in all health institutions, providing them with qualified management cadres who are able to deal with the developments in this field, in addition to setting up policies that ensure safety of patients and healthcare workers and prevent any human and economic losses. The training and workshop included lectures and hands-on training through group work and discussion panels conducted with the Infection Control Africa Network and the Infection Prevention and Control Department of the Ministry of Health. 25 attendees from Infection Prevention and Control Health Section, with other health practitioners coming from various primary and specialized healthcare institutions across the Sultanate, have benefited participating in the training.
The training that we have undergone for the period of 2 weeks provided us with a great learning in infection prevention and control. We are ready to exert all our efforts to make sure that we break the chain of infection in our healthcare facilities and community.
This training was a wonderful opportunity for all of us, as it has empowered with additional knowledge and skill to prevent and control infection.
Through its first cooperation with the Infection Control Africa Network, the ministry, represented by the Department of Infection Prevention and Control of the Directorate General of Disease Surveillance and Control, aspires to strengthening human capacity as it has put the training of national cadres in the field of infection prevention and control one of its top priorities within a comprehensive preparedness and response for public health emergencies strategy. Infection prevention and control is paramount in healthcare services. It protects both patients and healthcare workers from disease. Without controlling the spread of infection, healthcare institutions would become unsafe to go or visit, which would create huge healthcare problems across society. To learn more on that, with us is Dr. Amal Al-Ma'ni. Dr. Amal, a very good evening to you. Can you hear me?
Yes, Abdallah, good evening to you and all the viewers.
Thank you for joining us. Dr. Amal, in your opinion, what have changed in the infection prevention and control with the emerging of COVID-19?
So COVID-19 was really an eye-opener on the importance of infection prevention and control, and it has projected this specialty as a very important specialty in the preparedness and readiness for any public health hazard or outbreaks of infectious diseases. Also, it has superscored the importance of the connection between the healthcare facilities and the community. And this connection has to be also taken to the prevention part. Preventing infections in the community prevents its coming to the healthcare facilities, especially hospitals, where there is a high-risk patients that can get badly impacted by outbreaks inside the hospitals, and vice versa, trying to stop the movement of healthcare-associated infection outside to the community and spreading it in the community as well. So COVID really highlighted this as a big hazard and highlighted the importance that the specialists in the area of infection prevention and control not only concentrate their work inside the healthcare facility, but it should also extend to the community and ensure the community awareness and practice of infection prevention and control measures. So this is the one thing. The other thing, in order to be prepared, the globe has reviewed the implementation of the infection prevention and control globally. And there was really big gaps in the activation of the infection prevention and control programs worldwide, with very few countries that really their program has met all the core capacities that the WHO have set it for the programs. And the main one, which is building the human capacity in this specialty and giving them all the tools that they need to practice their specialty, and thus to go back to the healthcare and be tutor for the other healthcare worker and teach them how to protect themselves and how to protect their patients from the risk of infections. That all has been said. The number of things that they need to care about is only three: the human and the hygiene of the human, the hygiene of the environment, and the hygiene of the devices and tools. So if they can comprehend all the tools in ensuring the hygiene of the three elements, as well as how to stop the transmission between them by identifying, the vehicle for the transmission and stopping the transmission, they are achieving most of the procedures and elements of infection prevention and control.
Dr. Al-Ma'ni, what is the importance of this training for healthcare future? And if you will give one message to the community about preventing getting sick with infections, what would it be?
So the complexity of healthcare is increasing. We have an extension in all the services of the healthcare, and it becomes very complex. And within this complexity, you need really to prevent the healthcare-associated infections so that it does not create an extra burden in the healthcare by prolonging the stay of the patients in the hospital if they acquire one of those infections, or increasing mortalities. So really, enhancing the training of the infection preventionists and thus the training inside the healthcare facilities for the other healthcare worker is going to pour into decreasing the healthcare-associated infection, and then the work flow of the healthcare is going to be much faster and increase the quality and safety inside the healthcare. The message, and the big message to the community as well as to the healthcare worker, day after day we realize that the basics are the most important. The basic vehicle for transmitting infection is our hands. If we pay attention to the proper hand hygiene and to ensure that our hands are clean, I think we can succeed in 80% of the time to prevent the transmission of infections, whether in the community or in the hospital setting.
Well, Dr. Amal, we congratulate you for this particular training and we wish you all the best. That was, of course, Dr. Amal Al-Ma'ni, Senior Consultant in Pediatric and Infectious Diseases, Director of Central Department of Infection Prevention and Control, Ministry of Health. Once again, thank you.